Talking about obesity is important. March 4th, Tuesday, was World Obesity Day. Obesity is rising sharply in India, similar to other countries, but in India, the prevalence of obesity, as defined by a body mass index greater or equal to 24 kilograms per meter square, is about 11%, which is higher than many other low middle income countries and comparable to rates in high middle income countries. According to the National Family Health Survey 5, the prevalence of overweight and obesity was about 44% amongst men and 41% amongst women. This is an increase of about 6.3% for men and about 5% compared to NFHS 4 findings. And there is also a divide between urban and rural, which is that about 13 to 50% of the urban population and about 8 to 38% of the rural population are affected. Obesity is more commonly seen in women compared to men, and importantly and critically is increasing in children and adolescents. An important fact to note is that the Asian Indian obesity differs from that of white Caucasians, as Asian Indians have more tonal, truncal, intra-abdominal and subcutaneous adipose tissue, and more on all of that very shortly. Obesity is, and the reason we're talking about is, linked to many lifestyle diseases, being why it's an important issue to discuss at the workplace as well, and how to discuss it. I reached out to Dr. Chandrakant Lahariya, a well-known primary care physician, health policy researcher, and also founder-director of the People-Centric Health Systems. Dr. Lahariya spent several years in public health at the World Health Organization, and I began by asking him why he felt there was a big cost and an economic cost to obesity, as he had argued in a recent article in The Hindu.
So obesity definition keep changing and varies from one country to another country. But for long, one of the accepted approach to define overweight and obesity was body mass index. Like there is a broader consensus that a body mass index of more than 23 is overweight or obese. In certain European settings, it's a 27, which is obesity. In India, at 25 body mass index, which was obesity. And here I can clarify that what is body mass index. So body mass index is your weight in kg divided by your height in meter square. So height in meter square at the denominator and body weight in kilogram, and that gives you body mass index. So body mass index has been used variably, different countries, different parameters. For Asians and Indians, it's a little lower, and for other settings, it's a little higher. However, now there is a consensus that body mass index is not very good parameter, because what has been realized, and this is a concept called thin fat Indian, that Indians who are slim and within normal body mass index often have been found high body fat. So one Indian and one European with the same body mass index, Indian might have far greater fat, and then European or other population group may have a much lower fat. So BMI is now discounted or not considered a very good parameter. So there are new parameters such as waist circumference. In the female, waist circumference more than 80 centimeter. In a male, waist circumference more than 90 is considered obese. Similarly, there are other parameters, so waist to hip ratio or waist to height ratio. If waist to height ratio is more than 0.5, then it is considered obesity. So there are multiple definitions, but what is broadly agreed, and now there is a new definition globally, which defines of approach obesity as a clinical obesity, that is clinical condition because of excess fat in your body, you are considered obese. Within India, now there is a new guideline which have come recently, which say that body mass index more than 23 plus some other parameters, you are considered obese, grade 1, grade 2 obesity. Grade 1 without clinical conditions and grade 2 with clinical condition. But anyone who is more than 23 is obese as per some of the recent Indian definition.
Right. And when you argue that there is a hefty cost to pay, and which you also are referring to economic terms, could you explain why you're saying so?
There is a lot of data and evidence emerging. Of course, these are estimates. These estimates indicate that in the year 2019, the total cost of obesity in India was around $28 billion, which translates to around like 1,700 or 1,800 rupee per capita per Indian. Now, these costs are associated with at least two factors. One is the cost of healthcare, because obese individuals are likely to have other comorbid conditions such as diabetes, hypertension. I'll talk about common soil hypothesis a little later. So one of the cost is healthcare cost. There is evidence which indicate that obese person spend 32% higher on the healthcare than the non-obese person. So there is a definitive cost of healthcare in obesity. Second cost is a productivity loss. If someone is obese and has a comorbid condition, that individual need to had to miss the office or workplace, or his or her productivity decline. So these are the direct costs, but there are many other indirect costs associated with obesity, societal cost and mental health issues which are associated with obesity. So everything put together, it translates to the 2019, the cost was $28 billion, which translates to approximately 1% of India's GDP, which is very high. And then what is worrying that there are estimates that this cost is likely to increase to 1.57% of GDP by 2030. And there are estimates that if nothing is done or insufficient is done to obesity, this cost will further rise. So, because obesity is rising at a very high rate, like in the last 15 years, it had doubled. It had doubled in both children and adults. And last 3 decades, it had tripled in both age groups. More importantly, the obesity in India, the rate of rise in childhood obesity in India is one of the steepest in the world. Only two countries, Vietnam and Namibia, have a higher childhood obesity rising rate. So this is worrying. India has a big child and adolescent population. So all of these are worrying, and that's why we need to pay attention. And all of these have a cost. If you have obesity in childhood, which essentially translate a complication in the longer term. And I'll briefly introduce the idea of common soil hypothesis. It is widely accepted and proven scientifically, though obesity itself is a chronic disease as defined by WHO and many other associations, but obesity and diabetes are closely associated. Someone who is obese is likely to be diabetic, and that has its own cost. And we should remember that around 40% of Indians have abdominal obesity, adult Indian. There are Indians who have obesity, and then this obesity resulting in the liver disease, extra liver fat. There is a high cholesterol level, which can have a heart-related issue. And 25 crore Indians are either diabetic or pre-diabetic. That's one of every four adult Indian is diabetic. So these common soil hypothesis, diabesity, or there is a new term which is called ABCD, adiposity-based chronic disease, which is obesity. So adiposity, extra fat in body, essentially a single organ, and which has its cost. And if it affects in early childhood, if it is rising at a fast rate the way it is happening in India, it is worrying and it requires concrete interventions.
Quick question. So, in the context of individual, as in what can I do to test myself? And the second is a lot of companies and their employees are listen to this podcast. So, what could companies do as an initiative or an effort to do this? If so, or what should individuals do?
So I think this is a very important point. So one of the thing people can do, they should be aware about their weight. Often people are not aware that what is their weight and what should be their optimal or ideal weight. So one of the broader principle to know your weight is that your height in centimeter, and if you are male, deduct 100 from that. So if you are 170 centimeter, your optimal weight should be 170 minus 100 for men. So 70 kg should be your weight. So if you are extra weight than 70 kg for a 170 centimeter person, then you are overweight and you need to bring your weight within that range. If you are a female, person is female, then the value is height in centimeter minus 105, and that will be your optimal weight. So one should be aware about their weight. Second thing is that if you are extra weight, you should definitely modify your diet and increase your physical activity. Anyone, whether normal weight or extra weight, will benefit by improved diet or healthier diet or reduce physical activity. Third thing is that what you should do, that everyone should reduce high fat, high salt, high sugar, or anything which is ultra processed food. And you should increase your fruits, your vegetable, your legume consumption. So that's that individual level. But one of the things is that obesity is often likely to be affecting family, because the kind of diet everyone eat will affect everyone. So if one person is obese in family, you have a higher cholesterol level, it's likely to affect others. So get your lipid profile done once in every year. So those are the individual level. Third thing is that workplace should encourage, provide a weighing scale in bathroom or in those areas. Preventive health checkup should have a weight, height, and waist circumference measured. And similarly, there is a body fat composition analysis should be done. So raising awareness about obesity is important, and workplace can contribute. Most importantly, in India, we try to normalize excess weight and overweight. We feel it offending if someone is overweight and obese, and we don't want to tell that person. I would say the best service you can do to someone, don't try to normalize overweight. If someone is overweight, you should not say you look healthy or fit. You need to have a frank conversation that what is the ideal weight and how much do you weigh. So our societal thinking need to change. Individual, family, community, and institution actions are required. And of course, there is a lot can be done on ultra processed food, high fat, high sugar, high salt diet. Some regulations are required. We need to have a communities where we can promote physical activity. Schools are one of the area where intervention should be done.
Right. Dr. Lahariya, thank you so much for joining me.
Thank you very much for this important conversation.